Today we'll show you a patient that's 6 months after a SERI procedure. And that's a minimally invasive surgery we do. It's a fairly popular procedure. Basically started in Europe and does well for our patients. She's 6 months out, and you look at. We'll show you the pre-op and post-op, and you can see her foot looks really good. If you kind of go from the top of her foot to here, let's look at her foot there. And if you would, kind of move your foot through range of motion, your toe. See a good range of motion in her toe. If you look at what we have by range of motion, if we zero this out, range of motion, we got dorsiflexion at over 60 degrees, and then plantar flexion at over 30 degrees. So we got 9 degrees of range of motion in this joint, which is normal. 75 or above is normal. So you can see real good range of motion. Her VAS scores were pretty interesting as well, because at the early part of her, we do VAS scores by doing this and asking patients certain questions. And her score at first, when we first did her surgery, before we did the surgery, she had quite a bit of pain with the foot. Was having to limit some of the shoe gear and activity she did. So her VAS score to begin with, we'll give you that in just a second. I look that up in another thing we got. But anyway, VAS score has improved a lot. Now today, as far as like her pain, what kind of pain do you have now? This is 6 months later. Your foot hurt enough?
Nothing. Very little if I'm on it. Like a lot, and maybe some through here.
From the second toe?
Yeah, but other than that,
no pain.
No pain.
Now, before you had the surgery, from a scale from 1 to 10, what would you say your daily pain was, 10 being bad?
Yeah, probably it could go up to like a 5 or 6.
Okay, so it was kind of a moderate pain most of the time. And the surgery has gotten rid of most
Yes,
of
yeah,
okay,
pretty
good,
much everything.
Good. So we're going to show you her x-rays today too, and show you how this heals and what you can expect in different parts. So we're following different patients in different groups. We're looking at the SERI procedure, we're looking at the minimally invasive Alston-Aiken, and we're also looking at a mini Alston procedure, as well as a revered nice, and we're going to compare those together and how patients are doing 6 months later, and we're getting all that together. We're going to write hopefully a few papers with this, comparing these different procedures and how they perform, and how they look and how people do with this. So far the SERI has done real well with the ones that I've done, and she's a good example of that. So we're going to look at her x-rays and pre-op and post-op and kind of close this video out. And we may see her again, but this might be the last time. This is a 6-month follow-up, and we're following everybody for about 6 months right